What's up everybody, I'm Dr. Josh Jagoda and today I'm going to show you how to release the Popletius muscle. This muscle is really involved in a lot of anterior knee pain as well as possibly posterior knee pain. It's really involved a lot for those runners, some people who twist, cut, turn, squatting, jumping, anything where the knee kind of rotates inward a little bit. So those people who maybe have knee pain behind when they go bend down and go forward, that may be more nerve, hamstring type of issues, but if you're bending, squatting, twisting, turning, and you're having knee pain, this may be for you. So there's 3 ways to do it, but before we do that, I'm going to cover some ground rules. 1, you got to keep in mind that there is a nerve, artery, and vein back there, right? So be safe, be conscious, be smart when you're doing that, because if you have that numbness, tingling going down to the back of the calf or into the foot, you need to let off. Second of all, this muscle is deep underneath the calf. You may want to stretch the calf. You may want to roll out the calf. You may want to do some other stuff. But anytime you're doing this muscle and you're trying to get some leverage doing it like this, it's not going to happen, guys. The muscle of the gastrocsoleus complex is too big, too thick to get through that. You might get some of it, but you're not going to be effective. So you have to bend the knee. So now that we covered some 2 basic ground rules, let's get into the 3 variations. The first variation, I don't have a yoga block. So what you would do if you did have a yoga block is put the yoga block on the floor, put the ball on top of it, and keep the knee bent. Just like this. And you let some compression go through it. The reason I also don't show this one that often is because it's not enough pressure to get deep enough. So I'm going to show you the 2 other variations that do have that adequate pressure. So this muscle rotates you inward or internally like this. So if you were standing like this, it would rotate that way. So what I'm going to do is I'm going to take the ball, I'm going to stick it behind my knee just like this. Okay? I'm going to press it forward, and I'm going to just show you just like this. And what I'm going to do is the lower I grab, the more leverage I have, the more compression I get. In addition, the more compression I get, I will get a gapping effect within that knee here. So I want you to pull this forward very gently, rotate this in, pull a little again. Now you can really feel it. And what I want you to do is keep this pressure going in, but rotate that foot going out. And you can transfer it just like this. And hold that. And then come back in, rotate the knee in, pull a little bit, and rotate that out. And you can really feel that. And you hold that for a couple seconds at the end. So that is one way to do it while you're in the seated position. Another way is the kneeling position. Same concept. You're going to place this behind here. Foot is going to rotate inward. You're going to drive your butt to your hip, and you're going to lean a little bit. There you go. And now you're going to open it up. And then you're going to lean in a little bit. Good. Just like that. And you're going to rotate back and lean back into it. And that's a great way to get the Popletius. Again, guys, a lot of people will have posterior pain. A lot of people also will have anterior pain. So those people who have ACL insufficiency, had an ACL strain, or sprain I should say, ACL tears, this muscle is going to work a lot harder. And so if you have this type of issue or any scar tissue, sticking problems while in the squatted or twisting and turning, you're having knee pains and it's not resolving, definitely try this type of release. It really should help you. Alright guys, I'm Dr. Josh Jagoda. Thanks for stopping by. Don't forget to subscribe to our channel. We'll see you guys for the next one.